Hi, in section 5.4, we're going to talk about blood pressure. And I think everybody knows a little bit about blood pressure. Um, and so what we're looking at is here it says when the left ventricle contracts, one of the things you're going to notice is the muscle, that myocardium in that left ventricle is the thickest because that's the chamber that's pumping the blood the farthest. It's got to pump the blood throughout the body. Um, and so when that left ventricle contracts, blood's sent throughout the body, and directly it's sent into the aorta, and and then gradually it branches into the blood goes into the other arteries and the arterioles and the capillaries and the venules and the veins and back to the heart. And so what it's telling you here is blood pressure is the highest in the aorta. So when you hear about people's aortas bursting, if there's any weakening in the wall, it could cause cause the vessel to burst, particularly because that aorta has the highest blood pressure out of any of our blood vessels. And so what's happening is the farther you get from the heart, from the arterioles to the capillaries to the veins, you're going to get lower and lower blood pressure, which is why when someone takes blood pressure from you, they take it in a standard place because it will be different in different parts of your body. The other thing I mentioned already a little bit about the pulse, and the pulse is going to equal your heart rate. And so remember that the pulse is the expansion of the arterial walls. So when the heart contracts, the blood pushes through. And remember, we've got a thick muscular wall in the arteries, and they kind of expand a little bit. And you can feel that at certain places in your body as a pulse. And that would be the arteries that are the closest to the surface. Normal pulse rate is about 70 beats per minute. So that's about how fast the heart rate beats. The blood pressure moves the blood in the arteries. So as the heart is contracting, the pressure from the heart is what's moving the blood in the arteries. And there's a tool called a sphygmomanometer. Sphygmomanometer. Say that again, sphygmomanometer, a blood pressure instrument. And that's what we generally use to measure the blood pressure in the brachial artery, which is in the upper arm. And remember, we said the highest pressure is going to be when the heart's contracting and systole, so it's a systolic pressure. And then when the heart relaxes, that's the pressure in the heart when the heart relaxes diastole, or we call that the diastolic pressure. So it describes a little bit here about how what you hear and how to take blood pressure. But a normal blood pressure is around 120 millimeters of mercury over 180. Systolic when the heart's contracting, over diastolic when the heart's relaxing. And it gives you a little bit of breakdown here of what we would consider normal blood pressure. The term here, hypertension, is just another term for high blood pressure. And you can imagine if your blood pressure is too high, you can have you can burst blood vessels, particularly capillaries that are very delicate. And so people with high blood pressure can lose their vision from having capillaries burst in their retinas. They can have kidney damage because the creation of urine from our blood is very dependent upon lots of capillaries. So those parts of the body are particularly sensitive to high blood pressure or hypertension. You hear that called silent killer because a lot of times people don't realize they have it, and it can be very deadly. I like this graph. It's kind of cool. It's just talking about the blood flowing starting at the heart, and what it's trying to show you here is the blood pressure. So if the red here is arteries, and so the closer you are to the heart from here, the higher the blood pressure. And then the farther you get from the heart, the blood pressure kind of levels off. So it's showing you that in the arteries, the blood pressure is the highest. We get in the capillaries and the blood pressure drops, and we get in the veins, and that's where the blood pressure is going to be the lowest. Remember, veins have valves to help prevent the blood from flowing backwards because the blood pressure is so low. The speed of the blood moving is the fastest in the arteries, and it actually slows down the most in the capillaries. There's a lot of exchange of gases going on there and nutrients, so it's important that it's slower there, then it speeds up a little bit. But this is kind of interesting too, to show you out of, if we do the cross-section area of all of our blood vessels, we're going to have more area of capillaries than we do arteries and veins. And remember, I said if you cut yourself, you've cut capillaries. That's why you're bleeding. We don't very frequently cut arteries because they're a lot deeper. But if you do get a deep wound, you might cut an artery, and you can also cut veins. But you're always going to cut capillaries when you get a wound. We have a lot more of those. I think this just kind of talks about some of that I just said. It's talking about here how in the veins, the valves prevent the backflow, but also skeletal muscles, the movement of your skeletal muscles help the blood flow in the veins, and also breathing does too. So I'm going to stop right there, and that was section 5.4.